Hello, my name is Chloe Carter, and today my speech is going to be on the history behind disabilities, specifically Down syndrome. People have been born with disabilities all throughout history, some of which were not properly diagnosed or treated correctly for many decades. Most people believe Down syndrome is just a form of mental illness that makes a person dumb or incapable of doing things on their own, which is not true. I have a soon to be 21-year-old brother who has Down syndrome, and he is an extraordinary person. My parents had no clue he had this condition until he was born and it threw their whole world for a loop. Down syndrome occurs during fetal formation when abnormal cell division occurs which causes extra genetic material to be made and added to the 21st chromosome. Down syndrome has a long history with many unique information like body formations and function, mental problems and incapacity, and how to best care for a special needs person who has Down syndrome. Today I will be trying to address these topics more deeply. First, Down syndrome is a genetic condition that can show up in a child, especially one where the mother is having the child later in life. There is no cure for Down syndrome and no way to alter genes to stop this from happening. The only way to diagnose Down syndrome before birth is by using a test called amniocentesis, a prenatal diagnosis method in which a needle is inserted into the amniotic sac surrounding the baby. Even though there is no cure, things like speech therapy, occupational therapy, and physical therapy can help someone with Down syndrome live a more healthy and independent life. Some, like my brother, who has a non-working thyroid, which can lead to thyroid conditions such as hypothyroidism, can cause brain abnormalities, including Alzheimer's disease, dementia, depression, and seizure disorder. These people may have a set strict routine of doctor visits and medications for their whole lives in order for them to be able to keep living. Down syndrome people can come in a wide variety of shapes and sizes, with medical problems ranging the whole spectrum of possibilities. Most people recognize another has Down syndrome by things like smaller ears, a tongue that tends to stick out of the mouth from enlargement, and a flattened face. Down syndrome, according to reading Patterson, David, and Alberto C. S. Costa in Down Syndrome and Genetics, A Case of Linked History. I have learned a few things. In 1865, Gregory Mendel published his Laws of Genetics, and it was in this context that John Langdon Down published Observations on an Ethnic Classification of Idiots, his description of Down syndrome. According to Down, he believed Down syndrome represented a racial retrogression caused by instances of degeneracy arising from tuberculosis in the parents. Down would then force people with Down syndrome into a group that he called Mongol features. This caused the inappropriate term to start being used, and I personally have heard it being said behind my back about my brother all my life, which I find very offensive. The features were not just Mongol as they were unique. According to Pakistan Armed Forces Medical Journal, features of a Down syndrome person include depressed nasal bridge, hypertelorism, simian creases, short stature, congenital heart defects, gastrointestinal problems, and being heavier set. With a healthy, balanced diet and a comfortable lifestyle, a person with Down syndrome can live up to 60 years or more compared to the 25-year-old lifespan expectancy in 1983. Physical delays can handicap a person with Down syndrome, but another crippling factor can be the brain capacity and the mental thoughts that they may be experiencing. Most people overlook the mental aspects of this disability, just assuming the disability automatically means the person with the disability is dumb or stupid. While my brother is currently diagnosed with a mental age of 4, he is very skilled and knowledge when it comes to things that are practical, like taking a shower or cleaning up. While he will never be able to live on his own unsupervised, he does not always need help, and they can be very independent on their own and pick up on many social cues. I have been to many meetings with all the Down syndrome people in West Tennessee. So one thing I have really noticed is the range of mentality. Some, like my brother, had hard times forming complete and understandable sentences, although I was used to this kind of language and could decipher what it meant. Others could form complete and complex sentences that they were then able to use to continue a full-blown conversation with me. This all depends on the amount of learning the person has been going through, as well as just their natural cognitive ability. While my brother has a very clear mind of what he wants or needs, he has trouble verbalizing that in an effective way, and the same can apply for expressing his emotions and ideas. All of these things can be affected by how effectively a person with Down syndrome is taken care of properly. Older people with Down syndrome receive very specific care as well as a specific set of rules that apply to them. According to Heron Foster, Bobby J., and Jacqueline J. Bustos, nurses must understand that lower functioning adults are unable to communicate intelligibly, describe pain precisely, follow instructions, or give legal medical consent, in part due to the simplified cognitive skills and language underdevelopment commonly seen in patients with Down syndrome. One of the best strategies to help people with Down syndrome is preventative care, which involves things like annual examinations of all sorts of things to make that their bodies are performing at a healthy state. Portioning out the food they eat can help with controlling weight, and patients with DS must be handled gently as they may not understand the situation at hand. Patients may become aggressive or resistant if they are uncomfortable or unhappy with what is happening to them. I feel comfortable in the amount of review on the topics I did today, which were Down syndrome has a long history with many unique information like body formation and function, mental problems and capacity, and how to best take care of a special needs person who has Down syndrome. Not everyone will get the experience in their lives to spend time with a person with Down syndrome like I have. Sometimes I do get frustrated with my brother, but I know he is trying his best to make me happy. The deeper the connection is, the better the relationship is for all the people involved and the happier their lives will be. I am honored to be able to love someone who has Down syndrome, as it is an experience that will follow me through the rest of my life.